Thank you. Welcome, everybody. Welcome to this second webinar to discuss and explore a little bit more the work that we're doing in the febrile, around febrile illnesses in the malaria and fever team at FIND. This is a video series, and this is one really exciting webinar I'm looking forward to. But in general, what we're trying to explore in this video series is how we're using diagnostics for malaria, but also for other febrile illnesses to help improve the management of patients. And so this specific webinar is about the FIND Innovation Platform, and it's about supporting the development of malaria diagnostic innovations to advance their use in malaria endemic countries, and particularly here to advance the elimination of malaria in areas where that is relevant, but also in other areas where we really need new and innovative tools for malaria. So I'm very excited to learn a bit more about the work that our partners are doing as part of this initiative. And you can see here, we have a huge lineup and a really exciting lineup of colleagues from around the world. We have colleagues from Sudan, from Rwanda, Indonesia, and Peru that will share their experience here about the work in this Malaria Innovation Platform. And before we hear from those colleagues, I want to hand over to Dr. Rama Owusu, who works at FIND and is coordinating the work from our end. And she will start us off by giving sort of an overview of the vision of this platform and of this initiative that we launched at FIND. And then that will set us all up for the discussions to come. And I'm going to hand over here to her, and I'm excited to listen and follow the discussions that will come.
Thank you very much, Sabine, for the introduction. Hello, everyone, and Akwaba, as we say in my local Ghanaian language, welcome. Welcome, everyone, to the FIND Innovation Platform webinar series. This platform seeks to support the development of the advanced malaria diagnostic technologies in the world, and FIND, that is the primary aim of FIND, to support diagnostics development, particularly for our team, the malaria and fever team. So yeah, so globally there has been renewed interest in the attaining targets for malaria eradication in the world. And this is in line, or to align with, the 2030 Agenda for Sustainable Development Goals. There has been a reliance on the histidine-rich protein 2 based RDTs in many of these malaria endemic countries for clinical case management. Unfortunately, the circulation of HRP23 deletions, gene deletions in the different malaria endemic countries, which started off in Southeast Asia, and it's in South America, it's in Africa as well, which has threatened the performance of these malaria RDTs in the different countries. Thus, the innovation platform seeks to identify these novel malaria tests that can address these challenges, which I mentioned before, in addition to improving on the tools to identify Plasmodium species in general, as well as the need for improved surveillance. And importantly, we also hope to provide early and direct access to intended use settings for short-term targeted testing to accelerate research and development and access. The key benefits for development partners that took part in this innovation platform was access to intended use settings. Now, 3 broad areas were captured under this benefit. And the first one was access to data for regulatory approval. And we also helped support, we supported them in gathering data to help them with the design look of their products. And then finally, particularly with the digital tools, we supported them with the improvement of their AI algorithms, which you'll see some more of in subsequent slides. For the we had a round one of our innovation platform, which was divided into a phase 1 and phase 2. Our phase 1 took place between 2019 and 2021. And for this round one, phase 1, we supported 7 manufacturers in the development of their diagnostic tests. And the studies were conducted in intended use settings, particularly Sudan, Rwanda, and Indonesia. For our phase 2, which we are currently implementing, it will run between now and 2022, and it's going to support 2 manufacturers with the data to gather enough data to support their submissions to the WHO pre-qualification, hopefully to get approval. And in this case, the studies are going to be done, or we've already started implementing the study in Sudan, Indonesia, and Peru. Here on this map, you can see the study sites: Peru, Sudan, Rwanda, and Indonesia. And we tried as much as possible to capture the different geographic regions, which are technically the intended use settings for these malaria diagnostic tests in these malaria endemic regions. So for our round 1, phase 1, in the selection process for our manufacturers, our manufacturing partners, there was the call for innovation, which was published sorry, at the FIND website. And out of the 24 submissions that were made by the diagnostic developers, 7 were selected based on specific predefined selection criteria, which included technology readiness level 5, which is subsumed in the availability of prototypes at steady start. Another criteria was the intended use case, which had to align with our particular settings and use case, and as well as the suitability to site capacity, and of course the predicted acceptability to use in high burden countries. The products that were supported. So let me just talk a little bit about the products, the specific products that were supported. As I mentioned earlier on, there were 7 of them, and it included the Omnivis, which is a lamp-based test that is a handheld smartphone-enabled device, really fascinating to use. And it was designed by the Purdue University, and it's called the Omnivis. Then there was the Hemozoin-based rapid malaria test called the Gazelle, which is designed by Hemex Health, based in the USA, as well as the PLDH-based lateral flow assay with improved sensitivity, designed by Access Bio in the US. Now, we had an interesting digital tool that we found really fascinating. That's the automated microscope, designed by Nu from South Korea, and it's called the MyLab, which we think it's going to be one of the major contenders in the AI automated microscope field currently in malaria diagnostics. And then there was the PLDH-based lateral flow assay with improved sensitivity from Mologic in the UK. Then we supported, we supported Scanwell as well with their smartphone-enabled RDT reader in our innovation platform round 1 as well. So just to outline the key benefits for the developers as they took part in our innovation platform round 1, particularly with reference to the diagnostic development pathway. Omnivis, I already mentioned, we supported them in moving their product, progressing from the late product validation stage to clinical validation stage. For the 5 other tests, that is the Access Bio, Gazelle, Malaria Screener, MyLab, and Mologic RDTs, we supported them with data from the clinical evaluation to progress from the clinical validation stage to the product registration stage. And I'm really excited to say for Scanwell Reader, we supported them with data that they submitted to CE, IVD, and possibly to, they hope to submit to IVDR as well. And we're really excited about that. So for the 14 tests, the other 17 tests that could not get selected in the first call, FIND still supported them. We supported them with technical advice, we supported them with access to our FIND specimen bank, which provided them with samples, not necessarily at the clinical intended use setting, but with samples that had been previously collected from the intended use settings, and gave them access to those specimens from the FIND specimen bank to support them. We are really excited about this because there's going to be a round 2 of our innovation platform. It's going to be launched in January 2022, and it's going to be, the clinical study is planned for between 2022 and 2023. But for that one, the particular focus is going to be on biomarkers other than the HRP2 and LDH-based test. And we're really excited about this. So for more information, kindly contact me or check out our FIND website if you're interested in applying for this round 2 innovation platform, and you're interested in joining us for this round. And with that, thank you very much for listening to my overview of the innovation platform. And I'm going to give the opportunity to our site partners who are here to present the particular situations, the particular challenges, and the implementation successes for their sites. We're going to start with Dr. Muzammil Abdul Hamid from Institute of Endemic Diseases in Sudan. He's an associate professor at the University of Khartoum in Sudan, and he was one of the principal investigators for the innovation platform implementation in Sudan. Welcome, Dr. Muzammil, and I'm going to hand over to you to continue from here.
Okay, thank you very much. My name is Muzammil Mahdi Abdul Hamid. I am Associate Professor of Infectious Diseases and Parasitology, and I work at Institute of Endemic Diseases, situated at the medical campus, University of Khartoum. Today, I'm going to shed light. I would like to present highlights on the projects, studies we have performed. As part of the collaborations with FIND on the innovation platform projects, which support the development of advanced malaria diagnostic technology, which can get benefits from early access to field studies for visibility validity tests. And in this respect, we have performed prospective evaluations, 2 studies on novel malaria diagnostic tools, which Rana already has been talking about. Those innovative tools can overcome the limitation of rapid diagnostic tests. Next slide, please. Sudan is a large country in Central Africa, in East Africa, in Sub-Saharan Africa. Still, the country is large after separation of South Sudan. It has diverse populations and diverse ecosystem. The population are Arab and Africans, and they has diverse ecosystem from desert, semi-desert, low rainfall, savanna, and rich savanna. The climate is tropical with variable rainfall. The length and intensity of rainfall, in addition to the presence of irrigation plants, which provide the ideal habitat for mosquito and other vectors that transmit viral and parasitic diseases, determining the transmission season of disease. In the recent year, there is an increased burden of communicable diseases, which pose major challenges to the healthcare system. Next slide, please. Malaria is a problem not only in Sub-Saharan Africa. Sudan is not exception. It's a major health public problem. More than 75% of population at risk of acquiring malaria. The annual cases reach 0.4 million annually, and this is over 3,000 per annum, according to WHO 2019. Two transmission seasons, they occur during the rainy season and winter season. Plasmodium falciparum is the most predominant species, accounting for 88 to 90%. There is emerging Plasmodium vivax in the recent years, up to 12%, and it has a problem of relapsing and diagnosis issues. Next slide, please. WHO has identified three pillars for management and control of malaria: correct diagnosis and providing proper treatments, and also vector control. But these have challenges, have hurdles and challenges. Correct diagnosis is most important, but we rely on microscopy, which has inherent problems. It needs specific training and quality reagents. Rapid diagnostic test is very simple and rapid, but it has problem of it cannot most of them, they cannot identify all Plasmodium species, specific increase on the Plasmodium vivax, and also it has problems of the emerging parasites, Plasmodium falciparum parasite, which has HRB2, HRB3 deletion mutations. PCR is not a point of care, and it needs specific training and also require a sophisticated equipment. So next slide. Therefore, we need innovative tools for malaria diagnosis. In collaboration with FIND and other FIND, we have been involved in phase 1 in very interesting work and evaluating an automated microscope, all-in-one automated microscope solution for sample preparation to artificial analysis and data network. Is developed by Knoll. It's the atomic microscopy. It is very exciting and it shows encouraging results. We have also evaluated a smartphone application, malaria screen apps for automated parasite detection and counting, developed by the National Institute of Health, USA. And also we also used and applied the scan well RDT reader applications. It is very important for surveillance purposes. It is smart enable RDT readers. And also we have evaluated and improved BLDH based RDTs. It's a homologic one. It is a lateral flow assays with improved sensitivity and specificity. Importantly, we have applied stringent quality controls measurements and applied conducted clinical trials, which is complying with the GCP and good laboratory practice. Next slides, please. We have field setting in North Khartoum rural areas, 2 health facilities, Jazeera Slanj and Sorab, is 40 to 50 kilometers far from the centers. We encounter challenges for transportation issues, and those 2 sites are co-endemic for both Plasmodium falciparum and Plasmodium vivax. So you can have more tools, you can apply more tools in these settings. Those established health facilities serving patients seeking diagnosis for prior illnesses. And we have highly trained staff, GCP trained, medical doctor, lab technician, and nurses. So, and the implementations for those two studies we did for the automic MyLab and Mologic study went it was highly, we were very satisfied by performance of the staff and work there. And in the central lab at the Institute of Endemic Disease, we have qualified expert microscopists where we collaborate with the National Malaria Control Programs. We have molecular biologists and researcher, and we have also web-equipped parasitology lab, which can perform high-quality microscopy for malaria diagnosis and also external quality control. And also we have molecular laboratories who can perform PCR and RT-PCR. And we are collaborating with the WHO for nucleic acid amplification techniques. And we have facilities for storage and sample storage system. We also, through these studies, we developed skills in data entry and verification using the digital computer-based and the applications like open clinical software. Next slide, please. So we have evaluated innovative digital tools, and those innovative digital tools improve the diagnostic performance at point of cares. Hence better case management and control. The staff got trained on QC, malaria diagnosis, and GCP and GLP. Also the studies provided tools for improved diagnosis, microscopy, high quality microscopes, and SOPs for doing the microscopy, kindly provided by FIND for the field site and the central laboratory. Additional impacts, so they provide benefit to patients such as free medical care and also proper diagnosis to the local communities. And also site becomes, field site become reference laboratory for malaria. We have improved capacity for malaria diagnosis and for conducting clinical trials. Beside the non-monetary benefits, which are the we have trained teams and quality diagnosis, and also tools and equipment and publication. Thank you very much for your attention.
Thank you very much, Dr. Muzamil, and your team for showing us how you supported our innovation platform in Sudan, and also explaining how this impacted malaria control in Sudan. Let's now travel over to Indonesia in the Southeast Asia malaria endemic region to listen to Dr. Ruxana Ahmed and Dr. Rences Novianti, who are principal investigators in this study in Sudan. Welcome, Dr. Rences and Dr. Ruxana. Over to you.
We're going to present from Indonesia. I'm Ruxana, and myself and my colleague, Dr. Rences, will be talking you through the innovation platform study implementation in Indonesia. We'll take you through very quickly the process of the study implementation, the preparation phase, the day-to-day work in the field site and in the lab, and also we'll touch base on the challenges we faced. So next slide, please. Yeah, during the preparation for the study, we went through several steps. First is obtaining the ethical clearance. To obtain the ethical clearance, once the protocol was ready, we prepared the ethics form, submitted it to the ethical committee, and alongside it, we also translated the clinical record forms, the informed consent forms, and the participant information sheets. These were translated into Indonesian language and double-checked not to lose the context, and back translated into English. And once we received the ethical clearance, we shared it with our sponsor, FIND. At the same time, we also started the process of negotiations with the district health office, the health centers, where we were going to do the field work, and also in the community. So we had several meetings with the district health office and also with the health center, and we obtained their permit for doing the study. Alongside, we got the staff to engage with the local community to inform them about the study and our plan, what we're going to do and why we were going to do this work, so that once we started the study, we get a smooth run from the community and the subjects who come to the health center. One other important aspect is importation of the study kits and study materials. This takes several steps in Indonesia. We had to complete several documents to submit to different departments and ministries. And once that process was done, we got the import permits, and we shared it again with our sponsor, and we got the study kits transported and shipped. And then finally, it reached our central lab at the Eichmann Institute. Once all these stages were through, then the study team had a lot of work to do. They started packing up because we were based in Jakarta, and the field site is about an 6 hours flight from Jakarta. So we pack up all the study materials and ship them beforehand, and then the study team traveled to the field site. Once they got to the field site, they do the unpacking, log in all the material that was received, store them, pack them, and make it ready for their field work. Next slide, please. So after that process, we started the site initiation work. So there was training of staff. This time, the training of staff included GCP training and training of the lab staff. Initially, this was done by the sponsor as an online training. And then our lab staff, when they traveled to the field site, they trained the field staff on all the different study tasks. We also managed the study master file, where all the essential documents were filed, compiled, and master file was at Eichmann Institute, the laboratory. And also a secondary study file was set up and kept at the field site. The study files, as you know, is important, where anytime ethical committee member or regulatory authority member comes to visit the site, and they can access all the essential documents. And after all this process was done, we had the site initiation. This was again done by distance this time. In particular, when we were about to start the study, we were going through a very hectic period of the COVID pandemic. So it was all done distance, but later our clinical monitor visited the site as well for site initiation. Next slide, please. And with that, I hand over to my colleague, Dr. Rintis.
Thank you very much, Ruksana. I am a co-principal investigator. I'm Rintis Novianti from Eichmann Institute in Jakarta. So I'd like to give you a brief overview on daily work at the field sites. During the pandemic, the COVID-19 protocol was always implemented through wearing all the time the personal protective equipment. At the health centers, the sample enrollment was performed by screening the eligible participants having history of fever for at least 48 hours. And after giving the informed consents, the patients were recruited. And we moved to the Timika laboratory, where samples were brought to and undergoing further processing. That includes cataloging and RDT testing, microscopy, and data management. Next slide, please. For the data entry on every samples, the team used paper-based CRF for data collections at the field sites, and data was entered daily into Open Clinica, which was set up previously by the sponsor. In Jakarta, the data manager checked and cleaned data queries. In any issues occurred, these were conveyed to sponsor and resolved without delay. And at the end of the sample collections, specimens were brought to the central laboratory in Jakarta. Next slide, please. Which, as Roxana mentions, about a 5 to 6 hour flight from Timika. At the Eichmann Institute in Jakarta, the specimens were stored in freezers and PCR were performed as a standard methods, where our lab is part of the WHO UKNICAS quality assurance for any SOPs used to detect malaria parasites in our lab. Next slides, please. So we have, of course, some implementation challenges during the study conducted in field sites and as also in Jakarta. So through the preparation sites, we always have to be ready prior to the study start. We have to have an import permit process that requires multiple documents to be submitted to the health authority in Indonesia. And sometimes we found unexpected delays at customs. And for the training management, because this is our first new experience, and indeed lots of lessons to be learned for us, especially for the field staff, to conduct the study in a very well-mannered. And indeed, because at that time we employed various innovation platforms being tested at the same times, we have to be very fully concentrated in doing this so that it will minimize any bias or samples not being tested correctly. And also we found subject reviews to be included in the study because it is kind of, during COVID-19 pandemic, and they just couldn't be bothered to be checked for malaria. That requires, completing the informed consents during the sample enrollment. And COVID indeed has limited the subject visiting in the health centers, and the study staff also had to use the PPE, which is very unpleasant because they have to be at the health centers for like for example 3 to 4 hours to perform the study collections. And at the central laboratory, there's some lockdowns during the study conduct that can actually delay our study finalizations. And because of the distance between Jakarta and Timika, the logistics are actually very costly and then makes the study quite expensive to be done. But overall, we have overcome these problems and we finished our first study at FIND on a schedule already agreed previously. Next slide, please. I think at the end, I would like to thank you all for listening our progress from Timika. These are the pictures of the field team in Jakarta on the above panel, and the down panel is our field site teams in Timika. Thank you.
Thank you very much, Dr. Rintis and Dr. Roxana, for a wonderful presentation, lovely photos of the team. And thank you for highlighting that community engagement is necessary in conducting any study in any country. And at the same time, also pointing out the specific challenges that you encountered in your particular study sites. We'll now move over to Africa, circle back to Africa, specifically to Rwanda, to hear their experience in implementation of the innovation platform. And it's going to be presented by Mr. Abidan Nambajimana, who works with the Rwanda Biomedical Center and was the clinical coordinator of the study. Welcome, and over to you, Abidan.
Thank you very much, dear Eurama. I appreciate your introduction, and thank you very much, team, for having me. Okay, slides, please. Okay, as Euram said, my name is Abidan Nambajimana. I work with Rwanda Biomedical Center, and I'm a trained clinical research associate. So I have been working on this project with FIND as a research coordinator. So as you can see, actually, Rwanda entire around 12 million of populations are all at high risk of acquiring malaria. If you consider the burden of malaria in the country, according to morbidity and mortality, you can see that this still public concern in our country, especially when it comes to rainy season, March and May. So, okay, regarding on these ones, we have healthcare system in Rwanda. As you can see this diagram, we start from community health workers who are really doing a lot in terms of supporting other institutions like hospitals, Ministry of Health, and they are really contributing a lot. Next slide, please. So if you can see that malaria has been a problem in the country, but lucky enough that from 2017, we have been able to control and reducing the cases about 60% reduction to the mortality and morbidity. And this reduction has been due to the available factors that have been put in place, such as quality of care, such as use of long-lasting treated business, and the contribution of community health workers who are really doing very good in our country. So the tests that we have been using SD BioLine and the fast response, as well as microscopy. And this, next slide, please. This achievement has been due to the available policies and vision that are in place. And we have many visions like national science, technology, and innovations. And we have also the Vision 2024 for Rwanda to be a high income country. And the key enabler was being put in place, which is a science, technology, research, and innovations. And among those visions, we can just state some policies and instruments that are in place: science and technology innovation policy, market-friendly policy environment, and performance and accountability and transparency that have been put in place by the government. We have also, okay, apart from that one, we have a collaboration network in the country that are really helping all those achievements. As you can see, we have roughly 20 international collaborations of 144 countries. And as you can see, the number are good and doors are still open for more collaborations. Next slide, please. By responding and by continuing in that framework of improving innovations and research and the capacity, we have been responded to the call from FIND, which was targeted to improve diagnostic capacity, especially for malaria. And for this study, we conducted in collaboration with different institutions under FIND funds. The design was prospective, cross-sectional, and the performance evaluation study of novel malaria diagnostic tools, well health facilities receiving patients for routine malaria diagnostics. So the population, of course, was patients with symptoms suggestive of malaria who were seeking care from health facilities, and the sample size was 320. And several institutions have been involved, like the University of Gipe, which was actually been involved to make all administrative aspect of the trial, and CHUB, which contained the central laboratory, where many advanced tests have been performed. The Human Health Center was the enrollment and recruitment site, which was able to receive and screen participants to be involved in the study. And the Stanford Clinical Research Organization has really supported a lot and the overall responsibility was to ensure the GCP and the GCP implementations, regulatory aspect of the study, as well as engaging the community to the research. Next slide, please. And the achievement so far, we have been able to achieve a successful collaborations for more projects, and due to that implementations, the Central Lab at Shashube, the University of Gitwe, the Human Health Center have been able to sign the MOU to continue working with that framework, and other institutions, especially in Tanzania. We have Kilimanjaro Clinical Research Institute and another clinical research organization from Kenya who have been trained the network to really continue in that framework. And we have also been able to achieve a kind of capacity development of individuals, like our medical doctors, our nurses, our lab technicians have been really acquired tailored training from that particular research project. As we received good training, even though it was online by our clinical research manager at FIND, but they have been able to keep our capacity, and the teams are ready to accommodate further studies. We have also been able to discover some other unknown patterns of malaria, such as PVAX, even though it is a low percentage considered to the total sample of the populations, but we will think for further investigation and to explore more. Next slide, please. Okay, as part of lessons learned, we have been able to see that the PPPs, the private-public partnership, might be feasible and reasonable and implementable within the country, not only internationally. As I said, multi-institutions, some are public, like CHB is a teaching hospital, the university teaching hospital at a very good standard with well-equipped laboratory infrastructure and the technical staff who are there and having the skills to really continue performing that kind of technical work. We have also able to see that resource sharing is a key to achieve such kind of milestones when it comes to collaboration between institutions. As you can see, the University of Gitwe in collaboration with CHB as a central laboratory and the health center, the human health centers have been able to join their efforts and to share the resources. And luckily enough that the study has been completed safely and in a good way. We have been able also to see that North-South and South-South collaboration are possible, when it comes to fast-track benchmarking and capacity building. So we have been benefiting from the training and the capacity building from FIND, and that capacity has really provided our staff in terms of technical skills and even motivation to involve in the staff, and they are ready to accommodate other further projects in the future. Next slide, please. Next slide.
Thank you very much, Abidan, for the fantastic presentation and for emphasizing the role PDPs, product development partners like us FIND, play in country research agenda, in addition to global health agenda as well. We apologize for if there has been any for the interruptions in the internet. As you can see, this is the real life situation, and we often encounter internet challenges in our daily work in managing our projects, and we often find ways around it to work. Thank you very much for the fantastic presentation. Our final presentation is from Peru, and that's going to be from Dr. Catherine Torres and Dr. Dionisia Gamboa, who are our partners and principal investigators in Peru. And Peru was originally part of our innovation platform round 1, Unfortunately, due to the global pandemic COVID-19, they were unable to join the study right at the beginning. However, we are thrilled to find that to let you know that they are joining us in the round 2 of the innovation platform, and they are here to share with us their expectations for this study. Welcome, Kathy and Dionysia.
Thank you, Rama. I cannot turn on my camera. Thank you for the invitation. Dionysia and I prepared this small presentation about our expectation of the project in the area of the malaria elimination. Okay, first of all, we have expectation about the rapid test. We want to evaluate the detection of the p-falciparum HRP2 negative in Iquitos and Pastaza study sites, and also see the performance of these new and improved RDTs. The other one is the challenge of the malaria cases that we have now. The number of the malaria cases in Peru has reduced 75%, but low parasitemias are present in Loreto region. So this is a big challenge for us and a big issue as well. It conducts us to look for a new study sites. You can see here the study sites. We are looking for p-falciparum, and in Pastaza site, we have more cases of p-falciparum. Pastaza is far from Iquitos. Iquitos is the main city of Loreto region. But to get Pastaza, you have to take the boat for many hours, 12 hours more or less, or take a small plane, but they don't have a regular itinerary for a travel. So that's a big issue for us and a challenge for us as well because of the logistic. We have to take care of the samples and maintain the cold chain also. That's important for us. And also in Pastaza, we want to see the number of HRP2 negative cases. But we are willing to do this. The other thing is the impact of the results of this project, because we are in the area of the malaria elimination in Peru. So we need to see if we can use for malaria control strategies in Peru in the future. I think that's it. And thank you very much for your attention. This is the small team of FIND in this project. We are small, but we will be more.
Thank you very much. Thank you very much, Kathy, for showing us your expectations for this study. It's fantastic to see that in supporting us with this innovation platform and in helping gather data for the WHO pre-qualification submissions for this particular study. It's going to be highly impactful in malaria elimination in Peru, particularly with regards to the HRP23 deletions in Peru. So we are really excited about this to have you on board, and we look forward to a wonderful partnership relationship with you and the rest of the team. Thank you everyone for the presentation, and thank you for showcasing the specific situation, the specific experience you had with the implementation of our innovation platform in your countries, and highlighting the challenges and the implementation challenges and the successes as well in your countries. We move over now to the panel discussion, and I'd like to invite everyone on from all the countries: Sudan, Indonesia, Rwanda, Peru, can you please join us so we can have the panel discussion? We are going to talk about the key benefits of using this kind of platform, the innovation platform in your specific countries. First, let's hear from maybe Rentis in Indonesia. Can you tell us in implementing the study, did you identify any, perhaps you can tell us about one key technical challenge, technical advantage that you saw in this particular implementation in Indonesia? Rentis?
Yeah, thank you, Eurama. Yeah, first of all, we are very grateful that we have been able to be involved in this very important study conducted by FIND. So during implementations, we feel that actually our staff are becoming familiar with various RDT platforms ready to be used in the future, especially to detect malaria in a very high sensitive way. And this study together with FIND has actually increased the capacity building for our staff. So, the local staff are now, quite already familiar with any platforms that are launched by FIND, and also, the RDT that are being used by our countries in Indonesia. And also, we are all now being aware of any malaria diagnostic development developed worldwide. That's why now the staff are already, quite familiar with this, and we are actually very, optimistic that we can actually perform the study well to help in getting better malaria diagnostics in our country. Thank you.
And we are optimistic about this as well because of our prior experience with you in the first round and of our study. And so we look forward to this as well. Maybe Kathy, perhaps you can tell us one key technical advantage that you anticipate from this study. And then maybe we can have Pacific as well go next to tell us what they encountered before in Rwanda and what you hope to achieve in the next phase as well, next round.
Okay, thank you, Rama. Yes, well, we will have access to different diagnostic tools, first of all, to discriminate PFAS, parum, and P. vivax in Peru, since we have these two species. Additionally, to put in context the proportion of HRP2 and HRP3 deletion in our country, in areas where PFAS parum persists, and also the impact of the results will determine the necessity of specific diagnostic tools in the different malaria contexts, especially in areas where the malaria elimination process is a fact. I think this is the main benefits that we can find.
Yes, really great to hear that. Perhaps I know I mentioned Pacific initially because he's part of the team, but he's unable to speak because he has a cold and a flu. Sorry about that, Pacific. So perhaps Abidan might take this question. Abidan?
Yes, Olama. Can you come again to the question, please?
Yes, one key technical advantage from participating for Rwanda, from participating in the innovation platform.
Yeah, actually, one key technical advantage is that if people join the efforts, they can really achieve very far. If you can see, this has a kind of multi-level implementation of the project. Well, a public like Central Lab as a university teaching hospital collaborate with a private University of Kitwe to make sure that the research objectives are achieved in a timely frame. What I can say that multi-level collaboration in terms of private and the public can really advance the level of innovations and they really achieve very fast. Thank you very much.
Thank you very much, Abidan. And perhaps Professor Abdurrahim, maybe you can tell us about the Sudan experience, one technical advantage in participating in the innovation platform.
Thank you, Orama. Thank you, the panel. I, in fact, enjoyed very much all the speeches and the experiences through the globe. In Sudan, in fact, this project have three elements. I mean, the preparatory element where preparing the proposal and doing all these processes. This is a wonderful educational opportunity. Even the challenges with the regulatory bodies, the SEX, tend to be opportunities where we could network with these people. And the training to our staff, to the MyLab, to the microscopy, to the RDTs, to the reader, and to the scanner. These are all skills, new, excellent skills. We had an online training for all the staff. And look, when 18 people at least are directly involved in this work, they have all got training on GCP, on the different skills needed for each part of the tests. And some even supporting staff also not far from the benefits of this. So technically, we became very aware of the challenges of malaria diagnostics and of course, the program's requirements, control, elimination, and rollback, all these terms are becoming very known among the people. The big challenge was the enrollment of the patients with the ethical consent. You need to take a consent, which is very challenging, but at the end, people accepted that. We did not use to have it so stringent. Now you have to follow the GCP, you have to explain to the patients, you have to take their real informed consent and the minors as well. So it is a great, in fact, opportunity for the Sudanese team. And if the round comes to me, I have more to tell. Please let it come to me.
Definitely. Thank you, Prof. Abdurrahim. And I like that you mentioned the challenges that I like that you introduced the challenges at this point, because in surmounting the challenges, we are able to gain the advantages of taking part in the study. So I'm going to move right in from there.
Yes. I can just add that given this time
Abidan,
of the
yes,
pandemic,
Abidan, please go ahead.
Yeah, given this time of pandemic, we have built that everything in regard to online capacity building that is very possible. And if you consider, we were actually expecting the trainer from FIND to come physically and train our staff just on site training. And given the technology and the online, we have been able to follow all the training from day 1 to day 5. And everyone was very impressive and was very much motivated, and the skills expected have been really acquired without any disturbance. That means that technology can reduce the amount of time and even resources, can even reduce some challenges in regard to traveling programs, and the other associated costs. So you see that really with this kind of improving technology, we can really try to reach very far. Thank you very much.
Yes, Abidan, that's a very good point to make. And I realize it's, well, I'm sure everyone around the world who has gone through the COVID, and it's literally everybody, the whole world, we realized that before, previously we thought that there was no way we could do a lot of things with technology remotely, have meetings remotely, but now we've come to realize that anything can be done, even the implementation of a study, site initiation visits remotely. Speaking about the COVID situation, I would just like Catherine and Dione to just tell us about how the impacts of the COVID situation, how it influenced. Well, I know you were absolutely gutted when you were not able to take part in the first study, and it was a major challenge that you tried to overcome. Can you maybe tell us a little bit briefly, just tell us a little bit about and how things are different this time around?
Yes, Aurama. Well, about the COVID situation, it has a huge impact in our country, the first wave. So in the first wave, we didn't have any access to go to the field for the malaria program, the malaria zero plan in our country. They didn't have any access to go to the community with the strategies of the control. So it was a huge impact. But now we have about that, not specific for the situation, is one of the factors that the malaria has reduced in Peru, but the national has been working hard on so that's why we have now the number, the small or the low cases of malaria in Peru.
Yes, thank you. And we look forward to this. Well, right now, a lot of the countries are better managing the COVID situation, and we're hoping that it won't affect our studies this time around. And also, of course, naturally, everybody's health is our concern at first, before the projects come in secondly. So that's our priority. So just to wrap up, we've heard from everyone, and everyone has spoken about the challenges they've encountered in implementing the study. Maybe I would like to hear from everyone, and I think I'll start with Ruxana and Rentis. Maybe one of you can tell me what you anticipate that this platform can bring to other diseases. Maybe one success, how you think it can be extrapolated to other diseases in your country.
Maybe I give it to Ruxana first. Thank you, Rama.
Okay, thank you, Rentis. Yeah, I think this type of platforms could help with other diseases, especially with other infectious diseases and fever control situations where we have diseases, bacterial infections, viral infections, and also other parasites. For example, viral infections, we can consider dengue fever, which is very endemic in Indonesia, also respiratory infections. Since we are talking of the COVID pandemic, we can think of SARS-CoV-2, also influenza, and other viral respiratory infections like RSV as well for children, and bacterial infections, perhaps typhoid fever and pneumococci, pneumonia, and other parasitic diseases. So these platforms which can detect different infectious diseases and whose main presenting symptoms might be fever would be very beneficial to country like Indonesia, and also in rural settings, it would be very helpful.
Thank you very much.
If you want to add?
Yes, thank you very much. I just want to add a little bit, since we are joining this FIND Innovation Platform, so I feel that now our staff are becoming very well trained for any new malaria diagnostics platform. And yeah, we are able to perform the studies according to GCP indeed. And yeah, because we are used to testing of various RDT at the same time, so I think this is a good thing that now we are ready for testing for other fever-related diseases using a new platform that may come up from the FIND Diagnostics. Thanks.
Thank you for highlighting the different points, Rentis.
I would like I would like also to
Hello?
other points. Yes, we have got access to, it was very good to have established staff that can do clinical trials and in diagnostics, and we have trained teams. Also, we build capacity in our labs as well. Okay.
It's fantastic to see and hear from everyone, from all our country partners, and to see how everyone had the different experiences and different challenges, and wants to chip in and let us know how for their specific country, how things went. And the key point for me, and I guess for everyone listening in here, is that in developing diagnostics, it's important that the performance of the test is evaluated in the intended use setting. In this case, we have demonstrated here with our country partners, and we've demonstrated the roles that the site and country partners play in implementing such studies, and it's been a successful innovation platform. Round 1, as I said, please watch out for the round 2 of our innovation platform, which will be published at our FIND website in January 2022. And we look forward to receiving your submissions. At this point, I would like to say thank you for your attention, and thank you to our funders and specifically Australian government and the BMG, Bill and Melinda Gates Foundation as well. Thank you to our manufacturing partners and then our institutional partners as well in the different countries. Thank you for joining us for our webinar series.